Acetaminophen is an analgesic, meaning it relieves pain, and it's an antipyretic, meaning it relieves fever type of medication. And it is used in treatment of mild to moderate pain and in treatment of fever. And acetaminophen is well tolerated by most people, but sometimes it may lead to side effects, which we will talk about in this video. So starting with the first side effect, and that is liver damage. Now, acetaminophen is metabolized by the liver, and it can be toxic to the liver in high doses. Now, even in normal doses, there is still a risk for liver damage with acetaminophen use. Liver damage may manifest as acute liver failure, and acute liver failure symptoms include nausea, vomiting, sweating, confusion, loss of appetite, abdominal pain, and yellowish discoloration of the skin and the whiteness of the eyes, which is termed as jaundice. Moving on to the next side effect, and that is acetaminophen may lead to blood disorders. And blood disorders include anemia, which is decrease in the total number of the red blood cells, and leukopenia, which is decrease in the total number of the white blood cells, and pancytopenia, which is decrease in the numbers of all the blood cells. And symptoms of these conditions include fatigue and unusual bleeding or bruising and increased susceptibility to infections. Now regarding the third side effect of the acetaminophen, and that is the hypersensitivity reactions, which are also known as the allergic reactions. And those include skin rash, itching, swelling of the face, lips, tongue, or throat, difficulty breathing, or Stevens-Johnson syndrome, or toxic epidermal necrolysis. Now, acetaminophen may lead to electrolyte imbalances. Examples for that include reduced levels of bicarbonate and reduced concentrations of sodium and calcium, and also include increased levels of ammonia, urea, glucose, and increased levels of bilirubin and alkaline phosphatase. And acetaminophen may also lead to abdominal pain, nausea and vomiting, and it may lead to increased risk of gastrointestinal bleeding and increased risk for myocardial infarction and strokes, and it rarely may lead to kidney impairment that would manifest as increased levels of creatinine and urea, and it rarely may lead to drug-induced lung injury.